My name is Erin Galbraith. I am an interventional cardiologist here at HealthEast, primarily working at St. Joe's, and I've been lucky enough to work here for about 9 months now. I came here straight out of fellowship and did the typical job search that everybody does, deciding where in the country you want to live, what's going to work for you and your partner, what's going to work for your family in terms of making sure you can raise a nice healthy family in a good school system. And really, St. Paul and HealthEast offered the entire package for us. I knew that I wanted to continue to use all the skills that I had learned during my interventional fellowship, which included peripheral arterial disease treatments. And although that did not necessarily exist at HealthEast prior to me coming here in the cardiovascular arena, both HeartCare and our CEO have been more than happy to help me out and get me established with both interventional radiology and vascular surgery to be able to integrate that into my clinical practice. Groups in other cities tended to be a little bit top-heavy in terms of seniority, and there was a strong indication of when I interviewed at some other locations that starting out as a new person that you would definitely be lower on the totem pole and considered more of a worker bee than as an equal partner. Whereas here at HealthEast, my input was pursued from day one, even during the interviewing schedule, or who do I want to meet with? What are my goals when I come here? How can we help you meet those goals? And so this collaborative effort here at HealthEast was really, really welcoming and well received by both myself and my husband. The group of guys who work here, guys and gals, there's about 20 of us cardiologists total now, all work together extremely well. There's, as far as I've seen, no bad personalities yet. Everybody's supportive. There's great mentorship. If you ever have a question, run into something you don't know how to deal with, everybody's more than willing to drop what they're doing and help you out. There's this idea sometimes that cardiologists and cardiothoracic surgeons compete against each other, and you don't get that at all here. Everybody's supporting each other. If you run into trouble and you need the surgeon, they're there in a second. If the surgeon thinks that this patient is not a surgical candidate, they're willing to talk with you and work with you and figure out what's the best care options for that patient. And similarly in the peripheral or vascular disease arena, interventional radiology and vascular surgery were well established here and by no means had to welcome a new person into their realms. But they have been very welcoming and very supportive and have provided great mentorship. So themes in general, just always patient-centered care. That's got to be everybody's goal, not necessarily the goal of trying to make the most money, trying to see the most patients, but to make sure that you're taking good care of the patients that you are seeing. And then a good collaborative work effort where everybody supports each other as well. It's a job that meets all of my requirements, which was, when I was looking, I felt very hard to find. It's a job that supports you as a person, supports you in your personal life, and also helps you become a better doctor. And there's endless opportunities for personal growth, both career-wise, administratively, and just in terms of developing a newer and broader procedure profile.